Ladies and gentlemen of the media, thank you, and you are welcome to one of our institutions, one of the historic institutions in the country. Chris Henry Panagwanath is actually where I was born 40 years odd ago, and it's actually a proud moment to come here again. Today we are actually here to give you a progress report over a 100-day period that we have had in the office, and also highlight some few key achievements since we have taken office. It's one of the milestones that we are going to use moving forward to make sure that we are able to keep you in touch and keep you with us and following us in whatever we are doing. The next target, the milestone, will be our 20-month time, which is the 1 year point 8 months that we are normally having. You would know that MECs in Gauteng, they don't spend any time more than one year, 8 months. So it means next year, November, we're going to have another session and also say if we are continuing to be in office and we still be in our posts and position. Today, it's an International Gynecological Day, and I spent the morning today here at Baragani Ward doing what we call colposcopy, which is one of the procedures that we do after a woman has done a pap smear. It's just to evaluate further and see what else can we do and treat the abnormal cells that we find on pap smear. So this was part of my commitment to spending 1 day a month doing unpaid clinical work in all our facilities. So you would be seeing me going in other spaces, going in other facilities doing the same. I will actually do that work only in obstetrics and gynae, because only it's because of that of my own specialty. So I don't want to venture in any other something that I'm not competent on. So, but also we want to still call upon all other professionals to do the same, particularly those who are surrounding the hospitals that we have, to commit 1 day a month, you know, to doing community work and doing clinical work in our facilities. We're hoping that the call will be heeded and will be followed by many. And also today, coincidentally, it's a World Suicide Prevention Day. For us in Gauteng, it is a day to reflect on the work we do to fix and improve our mental health services in the province, so that we arrest the surging mental health scourge that is happening in our province, which also appears to be a global phenomenon. We are pleased to announce that within 100 days, we managed to open a psychiatric ward at Helen Joseph, and thereby expanding a mental health treatment opportunities in our system. Furthermore, in relation to clinical governance in mental health care, we have already met with the mental health advisory team, which is meant to advise the MEC on all the issues that relates to mental health services and campaign. And we also met with the mental health review boards, which is the one that is responsible in terms of accreditation and actually even doing inspections in all the facilities and NGOs that offer mental health services. These boards exist in all the 5 districts, and they've been very helpful in making sure that we are able to improve that service, but also to monitor what is happening in those facilities. In the State of the Province address, the Premier David Makhura defined the character of the 6th Provincial Administration as an activist and a responsive government. In line with that mandate to grow Gauteng together with our people, we have already found an effective way to connect with our communities. One of the ways is the one that you have been seeing, where we are doing unannounced visits to all our facilities. I think we have done more than 20 hospitals, bar 2. I know that I've not been to Kalafong, I've not been to Pretoria West, but all the other hospitals we have visited, and we have met different types of our workforce in those facilities. Whilst it's still early days, the past 100 days work indicates the Gauteng Health Story, which is beginning to change, and we are founding a new optimism that is emerging. We have set ourselves the ambitious goal of building a people-centered, clinician-led and a stakeholder-driven healthcare system in Gauteng. We have spent the initial days on a listening roadshow amongst our staff, patients, and the community. The system still has enormous challenges and opportunities and some pockets of excellence. The challenges are well known to many, and they are not insurmountable. In order to address these challenges, we have put in place a 5-year program to pursue the following strategic priorities. Number one, to pursue the rollout of the national health insurance in order to achieve universal health coverage. This, as a government in Gauteng, we are leading, and we are hoping that the public themselves will support us in the forthcoming public participation process about the bill, because this is the only way that we'll be able to make sure that we have enough funds and enough fiscus to be able to deliver a world-class healthcare services in the province. And we also, number two, hoping that we're going to improve patient experience of care in our facilities, and also try and raise the staff morale of our staff members. We know that these two priorities are interlinked and are interrelated, on the basis that if you have a motivated and a happy staff, a happy nurse and a happy doctor, you are definitely going to have a patient who's going to experience the facilities quite well, and they're going to receive the care quite well. The other one is just to make sure that we improve our facilities in terms of the look and feel, to make sure that the patients feel when they enter our facilities, they feel that they're entering spaces of care and spaces of cure. The third priority is on improving clinical services. That meaning that we are going to ensure the quality of the health outcomes. The fourth one is to improve governance and leadership, to ensure that there's greater transparency and greater accountability. The fifth one is to pursue a public education and a health promotion campaign that will help us to create awareness and mobilize the public towards healthy lifestyles. Mobilize the public also to take responsibility also of their health. In respect to the national health insurance, we have contributed immensely to the bill as a province, and it has been published, and now it's ready for comment, for public comment. We continue to mobilize social partners to be friends of the NHI, and part of it is that 293 of our clinics, out of a study that was done by OHSC, has been reviewed as ideal clinics. And we are one of the number one province in terms of the numbers of the clinics that are ideal clinics and that have passed the grade. We are also saying that our clinics are NHI ready. By the end of 2019, we'll have all our 24-hour community health centers fully functional, meaning that they will be able to provide all the services that are required for 24-hour service, meaning that they will have x-rays. For the clinics that don't have space, we are going to create space or even get mobile x-rays for them. We're also going to make sure that the emergency services in terms of trauma, they are actually also available. The point of care lab investigations, blood investigations, they will also be provided. That service will be provided in those clinics, and including the pharmaceutical services. Because we know that most of the patients that leave CHCs and get transferred to hospitals, they get transferred only on the basis that they have to go and do x-rays and also to go and do blood tests. And we are trying to make sure that the circuit is shortened and patients are treated at one point and at that level only. In terms of improving patient experience of care and raising staff morale, we have met SOPA commitments of putting a plan for not only 5 hospitals as the Premier has actually given us, but we have actually added another 5. So we've got 10 hospitals that we have to have a special attention to them, and to do upgrades in them and make sure that they are able to be fully functional and they are turned around in terms of their outcomes and functioning. Those 10 hospitals, I'm certain you still remember them, but it's something that we are committed in doing. Part of it is that when we end the financial year, all our hospitals would be OHS compliant. We are going to make the security upgrades in our hospitals. We are also going to do the renovations and refurbishments in all our hospitals. So this is a commitment that we are hoping that we are going to do, and we are committed in doing with DID, working with us in hand in glove. Why we want to do all these services at once, it's because we don't want to have a piecemeal approach on all our facilities where we do OHS and then we come back and do something else. So the whole refurbishment and OHS compliant refurbishments, including security upgrades, will be done at once. And when we leave the place, we'll leave it at once and making sure that it's functional. We have also included landscaping because as we spoke about patient experience, landscaping will also be part of the whole upgrades that we are talking about. In improving waiting times and speedy resolution of complaints, we are going to officially launch an app today. I'm sure that we are going to demonstrate the app, which will be Android supported and iOS supported. This app will be called Umpilo. It's going to make sure that we remove the handling of patient complaints from the social media, but only to deal with it in confidence and in confidentiality. That is improving the privacy of patients, because we have seen that a lot of complaints in the social media, in actual fact, ended up being fake news and also, in actual fact, violating the rights of the patients. So we want the app to be fully functional, and it will be there. It will be ready, fully functional from the 13th of September. And the digital revolution is underway. So we're using every means to make sure that we strengthen how we're going to function as a department. We have also visited 20 facilities across the province to engage with healthcare workers and patients on the state of those facilities, and also to get feedback on what things that we need to improve. This has enabled us to have a greater understanding of the issues from direct and personal vantage point. Some of the problems identified were resolved within days, while others are incorporated in the plans, in the improvement plans. Further, we've begun to take up our rightful place in the security cluster to improve the safety of safety in our facilities. Bara is the case that we need to raise with the public, that most of our doctors in the last 8 months have been attempted at hijacks whilst leaving the hospital or even coming into the hospital. We have worked with the SAPS to try to increase their visibility around those particular times where there's a lot of traffic around the hospital. And it's something that we also ask the community to help us, not to be attacking our health workers. And it's something that we plead with them. And it's something we're going to take it out with the hospital boards and also with community organizations around Soweto. We have launched an occupational health employee wellness clinic and a travel clinic for our staff at our head office. But this is part of the 10 clinics that we are going to open in all the districts, which our staff members will be able to access and use in the time of need or illness, and also in terms of mental health support. We have just initiated an employee value proposition project, which is aimed at creating more rewards for our health workers, meaning that we need to recognize the effort that they put. These rewards will be beyond a normal paycheck that they get. Importantly, this project will create a sense of pride and belonging and commitment to the Gauteng Health vision amongst our staff. In respect of improving clinical services, in line with SOPA commitments, we have just completed shortlisting of 14 CEOs of hospitals. and most of them will begin their work on the 1st of October, because this is part of strengthening our leadership and also improving our clinical actual services. We have allocated resources for filling up all the critical posts. The posts that we have that are vacant and that are funded are 1,974, and these are posts that will be advertised and will be filled in different areas of our facilities. And we're hoping that this post will be filled by the end of this year, not the end of the financial year, but the end of this year, 2019. We value the contribution of our community health workers who are part of the improvement plan. And we are in a process of integrating 8,794 of them into our PESAL system and our payment point. But besides being integrated, we are also committed in having a program to upskill them and also to give them more equipment, to give them more space of growth in terms of career pathing, those who've got capacity and who still wants to go further in their careers and who are younger. And this is one component of the health cohort that we are trying to build and strengthen up. We have agreed with our municipalities around Gauteng that we are going to incorporate the rest of the other community health workers who are in the employ of municipalities through NPOs. So our number will rise to around 11,000, and we're hoping that this 11,000, we are going to move forward with them and build them further. And in order to achieve our 1990 strategy targets, we have also allocated money, 4.9 billion, which will be moving towards treatment of HIV and AIDS and TB, and also making sure that we are able to keep those who are on ARVs, because that's the common problem that we have, that we struggle with, which we can't be able to trace the patients that we have initiated on ARVs. You remember that the 1990 strategy speaks about the 90% of us who are sexually active should know their HIV status. And those who are known, 90% of those who know their status and who are positive, they should be on treatment. And those who are on treatment, 90% of them, they should be virally suppressed. So this is what we need to do to try and fight the scourge of HIV and AIDS. And I think we are in the right path and we are doing very well, except that our complex nature of those who are in the second 90 that we are talking about. We have also engaged our termination of pregnancy service providers across all our facilities. The aim of the engagement was to improve the service, as we have received complaints from a number of users or patients that come through, but also to make sure that it's easily accessible and it's also within the line of being very friendly and very supportive in that regard. And we have partners in that regard who we are going to work with them to make sure that the service is properly provided. In terms of governance and leadership, we have made it clear to our senior management that the new administration needs to be responsive. So it means every problem or any complaint, we must be very responsive and on time. And we need to be very ethical in our conduct, and we need to be decisive. We have actually made it clear that those who are not clear about their role in the system or who still here just to tick boxes, maybe they must make way. But we are clear that we need leaders in the health system that are going to be decisive and take leadership and be ethical. We have drafted, we have a draft 5-year strategic plan in place now, which will be presented to the EXCO of the province and to the Premier after we have had our successful strategic retreat somewhere mid-August this year. So far, we have articulated the programs that are attached to the strategic priorities as mentioned above. We met with more than 1,600 staff members in the provincial head office and met hundreds more in our facilities to understand their anxieties and hopes and aspirations. We have a committed workforce, and we only support those who perform and make sure that the team Gauteng Health shines. As part of partnering with business to improve our service, we met with more than 350 small businesses who supply goods and services to our department. We assured them of our commitment to continuing using government procurement spend to support entrepreneurship development in the health space. However, we have expectation that they will keep and create more jobs for our people and grow the Gauteng economy. We take public accountability serious, and we account to our people via the legislature from time to time. We are happy to report that we have answered all the 42 questions that were put to us by the legislature over the last 100 days. Finally, in respect to the last strategic priority, namely of the public health education and health promotion, we have a draft program with various initiatives to ensure the levels of health literacy and awareness amongst our people. We will prioritize public engagement that focuses more on reproductive and sexual health, especially as relating to young women and young girls, as well as that we are going to have focus on mother and child health care issues. We believe there's a lot of transformative work that needs to be explored in this area. We have held forums and meetings that afford our various health partners the opportunity to shape and inform our policy and programs on topics such as the health market inquiry and its implication to NHI. We have also engaged in a program where we engaged young people on youth and reproductive health. And we also have engaged on a curriculum that relates to the role of private and the public sector professionals in the health outcomes. We have also engaged the media as the key social partner in carrying the Gauteng Health Story to the people. We have laid bare our plans for monitoring and scrutiny. However, we have also called on the media to report in the manner that upholds the highest ethical standards of journalism and the protection of patients' human dignity and rights. In conclusion, we have to thank the people of Gauteng for the privilege to serve. We have also wished to thank labor, business and civil society and the media for welcoming the 6 administrations more generally and the executive authority in Gauteng Health. We really want partnerships that work and that can grow Gauteng. The 100 days have allowed us to set the tone and gain deeper insight about Gauteng health space. We are confident that our plans resonate with the needs of our people and will stop at nothing to achieve better health outcomes. Much as challenges of migration and urbanization are acutely felt in the health system in Gauteng, we also know that the leadership is something we must fix as soon as yesterday. Without fair, ethical, capable and committed leadership, we will not achieve more than we already have. We really want more for our people and the future generations. Gauteng Health is too big to fail. The province is larger than 4 of our SADC countries combined. That is why we believe we have no choice but to build a people-centered, clinician-led and stakeholder-driven healthcare system. The Gauteng Health Story is indeed beginning to change and a new optimism is emerging. Thank you for welcoming us. The landing was a bit rough and the work continues. Thank you.